So starting nearest to me is Mark Collier from Heritage Healthcare in Trafford. Then there's Trevor Brocklebank from Homestead Senior Care, Karen Morse from Skills for Care, and Neil Eastwood from Sticky People. And once again, we've asked them to give a very brief introduction and hope to leave good time for questions and comments afterwards. So could we start with Mark, please, your introduction?
Good afternoon, everybody. Can you hear me? I feel awe-inspired because we're in such a esteemed company, and we're just a small little company based in Manchester. We've got 42 staff. We started 2 years ago. Could I just say something to the cabinet officers? Could I make a plea to you, please? Just to echo Colin's sentiments before, can we do something to try and professionalise and attract people to the home care sector? It's low-hanging fruit. We could do it. Also, could we please look at the DBS process? It just takes too long for us to recruit staff. You know, staff are having to wait 2 months to get a DBS back. We need the DBSs back quickly so that we can get people into work. There must be a solution. Anyway, thank you for that. We've had a lot of high-level speakers here today, and so I'm going to bring it back down to the ground. We just do the basics right. Our staff turnover it went up the other day actually to 11% from 10%. We look at the rotas. We spend so much time on the rotas, and because we're small, we can say we understand our carers. We understand what they want, what they need, the working practices, working hours. So we really look at our rotas and give the carers what they want. Okay, they share. It's a cultural thing as well. We're always talking about the culture. We do the values-based recruitment. We praise. We constructively criticise, because there are so many care companies in our area that seem to be carer-led. You know, the tail wagging the dog, and we don't have that. Is my mic okay? Yeah. So we communicate really, really well with them, and basically we just do the basics really well. We understand every single carer. We have an open door policy. It can be like Piccadilly Manchester train station at some times. You know, there can be 5 or 10 carers coming into the office or wanting to talk, but you know, if you have that policy, you have to adopt the negatives that come with it. So we can discuss any issues that they want to talk about, and we hone anything off. That's about it, really. Pass over to the expert.
Thank you very much. Can I ask Trevor?
Thank you. Before we get to the expert, I just totally agree with Mark. It's all about brilliant basics. That's what a care organisation is. There's no clever golden bullet. It's about doing the basics extremely well. So for those of you who don't know Homestead, 200 offices across the UK and Ireland, turning over about £200 million. Now, we started 11 years ago when my granddad had bad care, and that sort of growth sounds like we're very growth-focused, when actually it's the complete opposite. As a senior management team, we spent most of our time trying to slow down growth. Most of our established offices having waiting lists. If you lower your standards and take on more carers, you'll grow your revenues. You'll destroy your brand. You take on a block contract, big revenue growth. You'll destroy your brand if it's not at the right rate with the right conditions. We also have 18 offices with an outstanding rating in England and equivalents more in Scotland. We've never run a single course on how to get an outstanding rating. You get an outstanding rating by doing brilliant basics, not by focusing on getting an outstanding. And also last year we won the Queen's Award for Innovation. Although, looking at my academic colleague, I now realise that was actually the Queen's Award for doing the bleeding obvious. The bleeding obvious for me is we are a people business. We don't have any products, we don't have any stock, it's all about people. And therefore, if I could distill our success down to one single thing, it's excelling at recruitment and retention. You get recruitment and retention right, everything else in your business will work. If you recruit the right people at the senior management level, at the operational level, at the carer level, everything else will just happen. One of the things I'm renowned for in the business is motivating my team by telling them how important they are. Day to day, the least important person in the business is me. The senior management team, the franchise owners, they're not much more important. It's all about the care staff on the ground, making sure they've got the training, the support, the processes to do their job. The minute we get that the wrong way around and think it's all about the egos of the senior people, that's when we're going to fail. The other thing I really dislike is satisfaction surveys. It's not about satisfaction, it's about engagement. I love surveys that actually tell you how engaged your people are. It's easy to keep people happy. You want happy people who are doing a great job because they really believe in the quality that's being delivered. So it's all about recruitment and retention. And that, to me, falls into three key categories. One, getting your culture and values right. Secondly, getting your processes right. And thirdly, having the right business model. So if we look at the business model, we have an hour minimum call. There, our training goes way beyond minimum standards. We match clients and carers based on backgrounds, interests and personality. That's as much about having happy staff as it is about having happy clients. Because they have the time to care, they have the right training, the ability to do the right job. Surprise, surprise, we retain people, our turnover's low. We grow by about 25% a year. That means we need to recruit about 4,000 people a year. If you had a high turnover rate, you just couldn't do that because you'd just been trying to manage the churn, not looking at the growth. So saying no to the wrong person because they're not the right fit to you is hugely important, not just lowering your standards and taking people coming through the door. And we talked about recognition. It's not just about pay. Pay's part of the factor, but it's not the main factor by far, in my view. Recognition, people feeling they work for an organisation that really does want to make a difference, that's really going to empower them, that gives them great training, that gives them career progression. And that doesn't mean you're now a scheduler. It means can we give them career progression within the care field that they want to operate. The processes. Now, if we look at a recruitment process, for example, how many of you go to book a hotel at the weekend and they say, ring back on Monday and there's no one around? That doesn't happen. You get to make a reservation. Too many care companies, people apply for a job at the weekend and they say, oh, the recruiter will call you back on Monday. Well, if you're trying to recruit for a weekend, take the call at the weekend, interview them at the weekend and train them at the weekend because that's what you're looking to do. The simple changes to the processes are quite simple. But if you don't get that right, you're just going to make life difficult for yourself. That culture and values piece, it's having a real sincere belief in the importance of the care staff. That's what our business is. The minute we lose focus on that, that's the minute we start to fail.
Thank you, Trevor. I'm going to skip now to Neil, if you don't mind, Karen, and come back to you. So, Neil.
Yes. Thank you. Well, where do we start? I think toxic headwinds, we all know about those. That's a particular challenge. It's never been worse time to recruit and retain staff. So what can we do? I think there are things, if we all got together and if government got engaged, there are lots of things potentially that could help us all. Registration of care workers is one that I've been pushing for a long time. Also, I'm a fan of stretching the NHS brand across, to some extent, social care, or social care having its own brand that will make the public show or have more respect for what is really a Cinderella sector. But for all of us, what are we going to do tomorrow? I think then it comes down to what can we do that we have control over. And what I think is encouraging, a big opportunity, is that most of us in this room, however well you think you're doing with your recruitment and retention processes and where you're focusing, there are huge opportunities to improve. The world is changing all the time. Social recruiting is coming in rapidly into social care. It's already elsewhere. But I think I just want to pick on a few points and what can we improve? And sourcing would be where I start. Large generic job boards are not dying, but they are saturated and delivering a very poor quality of candidate universally. We are too stuck on that crack cocaine of internet job board recruitment. We have to move away from that. And I think Facebook is a place that I'm seeing far more success now. Very exciting, the successes that individual providers are having, cracking Facebook, getting a handle on that. I think having a strategy for the over 55s, Brexit is a total disaster. The horse has already bolted. In fact, I spoke to a provider, Homecare provider based in Woking this week. He's lost 4% of his workforce, EU workforce already, citing currency, but also they feel less welcome. So the damage is being done. We have to have a strategy for the over 55s, for other groups in the community that have not considered a career. Well, I wouldn't call it a career with the over 55, so a calling to care. So I think sourcing differently is something we can concentrate on. Candidate experience, as Trevor's already mentioned, try applying for one of your own jobs. It is shocking. And it's not, obviously, it's easy for me to say, isn't it? But if I was doing it, I would be equally, perhaps have done that. And I think looking at how fast we respond, another of Trevor's points, is, in elsewhere, every other sector, the consumer experience that we're all being trained to expect has gone up. And in social care, we broadly have stayed the same as we were 10 years ago. So we have to move that on. I think looking at what information we're collecting from people when. Do we need all of the information about them, what they did in 1976, and the references? Do we need that on the first moment of contact? We don't. We can stretch that out. I mean, with DBS, we've got long enough to talk to them, haven't we, before they actually become an employee. And if you talk to people, if I call somebody up at 5:01, I often get the on-call phone and get told to get off the line because this is the on-call phone. So thinking about that candidate experience out of hours, interviewing out of hours, absolutely agree there. And I think my third point would be local brand building. We have to fight against what I call the Death Star, your local NHS, who hoovers up, waits for you to train your people and then nicks them to some extent. So what can we do differently? And I think you can build a local brand. You can, and there are some home care companies that are very good at this. You're really only talking about a small area that you can get your brand out there in. That makes a big difference. People want to work somewhere they've heard of and they think you're looking after your staff. And I think finally, then a welcome program. If you get really good at recruitment, what then happens is there's a huge drop when you are account managed through your recruitment process as a new starter and you end up in operations and the care coordinator gets hold of you. Suddenly, where's all the friendliness gone? So you need to look at that welcome program for the first few weeks, a cohesive welcome program that makes people feel supported. And I think those are some of the things that potentially we can do that we can't, we'd have to wait for others to help us.
Thank you, Neil. And finally, Karen.
Well, somebody else did my homework for me because a few weeks ago we published a report called Recruitment and Retention, The Secrets of Success. But I can tell that they're not secrets because my colleagues on the panel here have already talked about them. So they're clearly well known. But I think one of the things that emerged was something that came up in the previous talk as well about Brexit, which is we've got a mantra about recruitment and retention being the #1 issue. But the word that came up for me, that shouted out to me, was about attraction. And I think that feeds very much into what some of the other panellists have been saying about how attractive are you as an employer. What's your word-of-mouth reputation? Because we know that those are very, very powerful ways to get people who'll not only apply to you, but already have the right values, already know something about your business. I think that absolutely we would agree that recruiting people with the right values proves the return on investment. When people do values-based interviewing, they find that their retention improves. I think that there's been a shift in the sector over development and investment. When I first started with Skills for Care, people would quite often say, well, if I train people, they leave. And there's certainly some truth in that, but that is a cost. Not training them and them staying is a risk, and it's a risk to your business. So I think things have really moved on from that. Interestingly, for the first time when we did this research, and we did the research with people who've got turnover of less than 10%, so sorry. But those people said to us that pay is very much an issue. And that's the first time it's emerged from us. People have often said it's not all about pay, it's about many other things. But pay didn't really emerge as strongly as it has now. I think there are other things as well that other panellists have already covered about celebration and involvement. But I think sometimes that, you're in a prevailing wind, particularly as a home care provider, and there's a lot to be said for getting involved strategically. So recently we've started a project funded by Thames Valley Local Economic Partnership. It's the first time they've ever funded anything in social care, and it's showing real returns because it's an end-to-end, multifaceted strategy. So we're doing things like work experience, core skills, as well as values-based interviewing, as well as recruiting recruiting within older workers, people who haven't had access to the social care work market before. One of the interesting things that stood out for me in the secrets of success is that those people who said that they deliberately targeted young people from 18 to 25, they were the people who had the most success with that particular part of their strategy. So it's also about thinking beyond the traditional candidate.
Thank you very much for very interesting presentations there, and we have a little time for questions. So your questions, please. Right, okay, well, let's... Yes, sorry, I cut you off last time, so it's right that you should have the first question.
It's
this time.
actually, you can hear me, yeah? It's actually my same question.
Oh, good.
It's just about austerity, and austerity is still real, I think. Quite often the commissioners are the middle people. I'm a former commissioner, not commissioner now, so I can say what I like. Is that often the commissioners are the middle people when we're talking about contracts and things like that, and whether you can get outstanding when you're paid such a small amount. When I first, and this is from a very personal point of view, when I first moved to London, which was 20 odd years ago, I was attracted by social care because of my values, but I was able to live not far away from where I worked. So I could afford to rent, I could afford to live my life, I could afford to have a nice life as a young person living in London. You know, these are the people that we really want to attract to our sector. And pay is an issue, and the only people who say pay isn't an issue are people who are not earning the same amount as people who are on the minimum wage and can't afford to live near the places that they work. So I think that, you know, the one thing that I would say to everybody in this room is that fight needs to happen, and you know, we need to be fighting for people who are on those low incomes, because we're not going to attract, if we get to the end of, we get to Brexit and we're not attracting people who are willing to take low pay, then we are going to be in a position where we've got nobody to provide this care. So I have to say that, you know, as a person who came to London and got a great career out of it and have really enjoyed my career and stayed in social care for my entire career because I could afford to, I think, you know, those young people coming through, I've got kids, I can't encourage them to go into social care because it's unaffordable. They can't live here as a result. So that is my plea to everybody here.
See how well that went down. I mean, it's a constant frustration to me that we end up arguing about national living wage and a national minimum wage when actually this is a role that should be paid significantly above that. We shouldn't be bumping along the bottom. But things are as they are at the moment. Now, panel responses.
Professionalising what we do is equally as important. As I think that people need to really to have something that says, I am a good carer, I'm a good care worker, and I've been accepted into an association because of it. That's the other thing.
Neil, I think... Oh, sorry.
Yeah.
Mark.
Well, because 80% of our work is in the private market, our business model enables us to say to the carers, this is what the business will look like in 12 months' time, and this is what your package will look like in 12 months' time, and these will be the openings, because it's an owner's responsibility to develop a model and a vision and projections, and there's nothing more powerful than actually saying something and then it actually happening. Okay, so I agree with you. In terms of the commissioning side of things, I just don't know where companies go who are on ultra-fine margins, you know, of 15, 20%. I don't know where they go in terms of planning from the minimum wage, because we have a company, there's a company in Manchester, they turned over about £29 million. They lost about 700, and this is information in the public domain, they lost about £750,000 in the last financial year. Add the minimum wage increase, add the pension legislation, they've got another £400,000 added to their P&L, and they are one of the biggest providers. So where do they go?
Trevor.
I think it's a scandal that you can earn more stacking shelves in a supermarket than being a carer. I mean, we should not be losing anybody. It should be the opposite. We should be attracting people. We are predominantly private, but I think there's a misperception that private pay means you're only for the wealthy. almost a half of our clients use direct payments there, and will top up £1 or £2 there. So it makes it much more affordable. And it also goes back to John's comment. One of the things we can do is reduce the package, because we can, going in and cooking for someone just takes their independence away and makes them more reliant. You actually want to get them back to be mobile, to doing their own cooking, and that might mean a slightly bigger package in the short term to increase their mobility and their independence longer term. So the whole model needs to change. Going back to that career progression, if we're looking privately and someone wants a dementia specialist and they'll pay more for a dementia specialist, then that makes sense. So we can train people, they can have a career progression, they can become the dementia team leader. There are options available that you can't do when your margins are so wafer tight on a block contract.
Anybody else want to comment on that? Or?
Yeah, I'll have a quick comment. So pay is complicated. Let me give you some examples. If I was a retiree with a spouse that's already working, or I had a pension, and I saw real value, intrinsic rewards in working, would my attitude to pay be the same as if I was a single mum on benefits struggling to cope? I think there is different rates, or you would look at the value of what you were earning in a different way. We wouldn't have no volunteers if you follow that logic through. In America, some years ago, 18,000 care workers had their salaries doubled, their hourly rate doubled for two factors: unionisation and the living wage in the state. And very interesting, what happened after 2 years, 18 months, is that the retention rate dropped. It dropped. It didn't go up. And what was happening, we think, was that it attracted anyone in. So I might be getting cold in Quick Fit with my overalls on, think, flipping heck, cup of tea and a slice of cake with Granny, I'll go and do that. It's about screening and choosing people with the right values, which Skills for Care are very good at pushing. So there's that factor to consider as well. We also know, once you're in the job, in polls of what you would consider your good workforce, pay comes out 7 out of 10. It's not in the top 5. Yes, everyone should be paid as much as we can give them, but it doesn't matter as much. It matters deeply in recruitment, where we can see if you increase your pay rates, you can get huge increases in applications. So I think it's a very nuanced argument. One final point I'd like to make is I'm seeing a growth in performance-related pay. So it's imagine I was a care worker doing a good job, I've been working with your organisation for 3 years, and then you hire somebody who we all know is not going to stay, and they're on the same salary rate as me. How does that make me feel? So we need to think of ways of either rewarding people over time, and if they stay longer, I would argue you're saving money. And also performance-related pay has worked, where you give people discretionary bonuses for attendance and so on. But yeah, there's lots to talk about.
But I think the care sector has a reputation for being low paid. If salaries were to increase, Neil, I think you would open it up to a lot more people, who would be a carer, but they don't come. The main obstacle is the pay. The pay should reflect the responsibility, reward. Responsibility equals reward.
I think the two arguments, there's a minimum amount that we ought to be paying that we're not paying. Once you get above that, it becomes less of an issue, but there's a minimum amount that we're a long way off.
If you're on a low pay, and if you're on a low pay and you're in a job that you love, but you're still going to a food bank in order to feed your kids, it's not going to wash. No matter how much training or support or how much you enjoy your job, it isn't going to happen. So I just think that it's that serious at the moment. It really is.
Okay, thank you. Lots of other questions now. Jane first, and then we'll come to the middle table.
Thank you. I've got a question about registration of care workers, because on one level we can all agree that's a good idea. The devolved administrations are trying this to different degrees, and one of the dangers is that we drive even more people away from the sector, because they're expected to bear the costs of that registration partially themselves, or the agencies, and if not making any margin. And secondly, the bar is being set in some areas very high, college education type of qualifications. And I think in Wales they're having these discussions, and somebody sort of said, well, we could lose 25% of the workforce because to go and work in Lidl's. So it's how we find that balance.
I'm going to take the other two questions as well while you're thinking about your response, and I'll come back to you afterwards. Okay, so the middle table here.
David Weatherly, Walnut Care. We were a pilot for the value-based recruitment, so we've been doing it for a while now. My problem is to do with childcare, and would like to know what the panel's view would be. I obviously believe we want all these lovely values, and then what I expect my mostly female carers to do is to get up at 6 o'clock in the morning, take their child to a childminder at 6:30 in the morning, and then leave them there. What does that say about me and our sector that we ask them to do that to their children?
I'm just going to pause there and then I'll take the next two questions together. So can we take those 2 points, please? The first one about registration of care workers and the second one about childcare or family care, shall we say. So who wants to go first?
Well, in terms of registration, I think you're absolutely right, and it needs a very balanced approach, and I think that we don't know enough yet about what the impact might be. So I'm quite interested in it as an issue, and sort of vaguely in favour. I don't think Schools for Care has taken a view on it. I know it's been a subject of some conversation recently, which is new to me, because I think we had a burst of activity around registration 3 or 4 years ago, and it's recently come back onto the agenda, so people are clearly thinking about it. And I think there might be some local initiatives as well, where local trade associations are looking at launching a PIN number for care workers. And I can see some financial advantages in transferability of things like, DBS is meant to be portable, but really isn't. And I think registration would really help with that and reduce costs for employers.
The civic comment I'd like to make is half our workforce is over 50. And I think the care sector is particularly suited for there's a lot of people may have taken early retirement, a lot of mums where the children have now left home, they've got time on their hands, haven't had a career and want to create, they're having a career later in their life. This is a brilliant career one of the challenges with registration, however, is I'm 60 and I want to go into a job that makes a difference. I don't want to go back to college and do all these qualifications, so we need to be careful not to put off the exact people that don't need to worry about taking children to childcare at 6:30 in the morning. We have two distinct type of carers. We have a lot of mums with young children, and we will look at different rotas and different paths for them there, and then we'll have the different, and the two very distinct workforces with very different needs.
My concern is just back to commissioners. Commissioners, they said this earlier, they want you at 7 o'clock in the morning, that's what they constantly say, and that's the balance, isn't it? Service users, personal choice, they're asking for 10 o'clock, they want 7 o'clock in the morning, 7 o'clock calls in the morning, we want to deliver person-centred care, and it's balancing that need. And I don't know, is it a communication to the public at large and saying, well, a lot of our workforce, 50% of it, do have families. Can we compromise? Could you not have your call at 8 o'clock in the morning, actually when the capacity's there? And I think we could actually have a huge increased capacity. And it's perhaps having that, how do we communicate that to people? Because they say, I really like that carer, but I'll say, well, she can't come at 7 o'clock, she can come at 8.
And I think that's part of the conversation you have, and I think it goes back to your processes need to look after your people as well as looking after your clients. And that doesn't, what I don't want to do is say, we'll turn up at 7 and you turn up at 8:30. I'd much rather say we'll be there at 8:30 and be there at 8:30 on the dot.
I think you have to manage people's expectations at the interview process as well, and tell them what the job's really about, and ask them what the hours they want to work, and if the business can accommodate that, then support them.
It also, I think, fits into the zero-hour contract conversation. A lot of, particularly our over 50 carers, want to be able to, they want to take 3 months off and go to Spain in the winter, and they want to work the hours they want to work. They won't work at 6:30 in the morning if they don't want to. Other people want set hours there, and here's my 40 hours, and the quid pro quo, and that is you will work when you're given the hours, because that goes with that contract. So again, zero contracts aren't bad per se. There's some very bad implementations of them and people abusing them, but that doesn't mean as a concept they're wrong.
Okay, we've got a number of hands now, but I'm going to take the lady over here and then come back to Mike, and then I'll come on to you afterwards.
Thank you. My name's Janet Febri. I'm from a small charity called Crossroads Care Richmond and Kingston. We provide respite breaks for carers, and I agree with Mark and Trevor entirely about valuing staff. But we've got a problem living in a very expensive area where housing is extremely expensive, cost of living is very expensive. Our recruitment, what we found is the 55-year-olds aren't there anymore. They're caring for their parents, caring for grandchildren, going on cruises. The youngsters don't want to do personal care. We get them through the door, we talk about what we do, we talk about the rates of pay, we pay for their training, the value they get, and as soon as we mention personal care and working in the home or the community, don't want the responsibility. So we've got issues at the moment, as everybody has. I think the other thing to alert people to is there seems to be a lot more organisations who suddenly don't want to do regulated care and are going into befriending. Yeah. And my concern is what happens if there is need for personal care. So I'll leave that with you.
Point. Thank you. Mike, and then the gentleman in the middle.
A quick point and then question. If Neil's here from the CBI, I'd just like to touch on a point that Neil Eastwood raised, which was using sort of performance-related pay. We've used reliability bonuses with staff, trying to incentivise the good performers and so on. I think that's great, but the minimum wage legislation makes it very hard to include those enhancements and for them to count towards the national minimum wage. So we're now having to move away from those because everyone's sort of bouncing along at the bottom, trying to ensure compliance with the statutory legislation, and I don't think that's right. And I'd ask the CBI on a low pay commission to try and consider that in as they take their work forward. My question was going to be around applicant tracking systems and whether they're essential for businesses of a certain size. I get all the points around values-based recruitment and all the great things that you've spoken about and are in Neil Eastwood's book. We follow all those things. At what stage do we need an applicant tracking system, or can we make do with our rostering software solutions towards tracking candidates when we're trying to recruit in volumes?
Okay, I'm going to take the third question, and then I'm going to ask just one person from the panel to answer each of them. So take your question.
Although I think this has been very positive, it just seems to me that there's a lot of hypocrisy around everything that we're discussing, because at the end of the day, I always say, if you pay for it, you can have it. And the government is in denial, local government is in denial, and we're wringing our hands and trying to think up all these wheezes to how we're going to get through this. And they're only going to take notice when they can't have the service. See, if you haven't got the staff, you can't get the service. So what's wrong with that? I think, this needs to come across more clearly, and we've got to be a bit braver in the way we approach these things, instead of keep sort of creeping up after these sort of second-rate politicians, trying to sort of get them to throw a few crumbs to us. Thank you.
Thank you. Well, shall I just go down the line and you answer which of the questions you want to answer? Neil, can we start with you?
Yes, okay, so first question was crossroads care, I think, and that is a thorny issue if you're in a wealthy area. I would say, particularly for Crossroads, they focus on respite care. They're very connected with family carers, and we know that family carers can make excellent paid care workers. There's a study in the US that found that those that were family caring, 47% said that had they been aware of it, they would have considered a paid career in care, either if they could do it in conjunction with their current care responsibilities or after, perhaps the caring responsibility has stopped, and they understand what personal care is. They're a very high potential group. So I think, not sweeping away any of the other issues, it is very difficult, but there are pockets of people in the community. We know people that worship, people, even pet owners. There are lots of little pockets of people that you could potentially have a dialogue with. On Mike's point then about applicant tracking systems, I have quite a privileged view because I speak to about 750 of you each year, particularly recruiters, and I am getting, since beginning of 2006, I was asked more and more about applicant tracking systems. There are 164 for you to choose from. I would say I've seen implementations where for larger organisations, multi-site organisations, they found what effectively they had done is built a motorway stopping at a farm gate. So centrally you would see where move all the applicants to the point of the local manager, and the local manager's too busy to review them. I should say, for those of you that don't know what an applicant tracking system is, it's a candidate management system. You would have a dashboard, that's the trendy thing, and you, as people apply, say on job boards and other, they fill in their own details, and you would see them in a column as applicants. You could review them and then click and drag them, in theory, to, say, to the next stage. That may fire off an automated email. So they're meant to, and I think in many cases they do, make life easier. Certainly you can have a speed of response. The question really is at what size. You can use them. There are price points now that very small businesses could use them. I think we should be looking at them, but they are not a panacea. It does not remove some of the other fundamental roadblocks in terms of people having the time to review and putting the importance on recruitment that it should have. And I think, I think I'll probably leave it there and let the guys...
Sorry, Neil, I need to hurry people.
Yeah, that's fine.
Karen.
Just briefly on the gentleman's final point there, I think that there are some opportunities going forward to, I know that Neil described them as a death scar, but working with health, there's an awful lot of money in the health system that's wasted because we don't have good social care. And maybe one of the potential advantages of having place-based care is that you can look at very close solutions. So, for example, having schemes that invest in social care to prevent admissions, to care for people longer in their own homes. And dom care services should really be at the vanguard of that, to borrow a phrase. But it's often quite difficult to negotiate with such a fragmented sector. And I think there is a real issue around there, and clearly a role for UKHCA, who I know work on this. I think there's going to be a lot more local economy to look for more local solutions to the vast expenditure in health going forward.
Thank you. Trevor.
I think the solution is going to come bottom up, not top down. So we need to work with the commissioners and the local authorities, and we need to say no. If a contract's not right, if we all said no, they'd have to change. But there's always someone coming in at the 11th hour saying, I'll do it. So my plea is, don't take work on that's not sustainable. The applicant stacking systems, what gets measured gets managed, in my view. The more data. So I think everyone ought to be doing a carer satisfaction stroke engagement survey, and you all ought to have a system that logs. Because quite often the problem isn't recruitment, it's the recruitment process.
Thank you. And finally, Mark.
Just very briefly, applicant tracking system, maybe, maybe not. Get back to candidates within the hour. Watch out for Google. 60% of the business is going to be algorithm-based in the next sort of 5-10 years. Yeah, totally agree. Totally agree with the system's broke. If the NHS could measure, if there was a way of measuring people who receive poor care in the community going into hospital, then the government would, and the local authorities would pay the price for good quality care, and it would take a lot of the strain off the health service for financially and bed blocking. Empathise with you, we're in a similar situation. If you want to talk to me or some of the other people in our location around the room, please feel free to do so.
Thank you very much. Maybe now is the time to mention that we also have a representation from Nhs England in the room as well, so I'm sure some of that will go back. Thank you very much. I'm sorry I'm having to cut this short, but we are behind schedule now, so can we say thank you to the panel?